Hello again, Dr. Jason Schlenker here. Today we're going to talk about foam rolling. Now foam rolling is a fantastic way to do some self-massage or self-myofascial release. It's a cheap and very effective way to get to those muscles, get the blood pumping around. Now there's all types of different foam rollers out there. It goes from like the white that's super soft, kind of a blue marbled color, all the way up to the black in the foam, and then you can go up even higher levels. You have the kind of the PVC pipe with some foam around it. You can go up to, you have steel. A lot of CrossFit gyms will use steel so it gets the cold effect. Or you go all the way up to the Olympic training facility where some of the guys use shot puts. Now, I recommend these to all my patients, whether they're athletes or non-athletes or just office workers, because it's a great way to kind of self-mobilize, get some stuff moving around. Now, the purpose of the foam rolling is to increase blood flow through the muscles and release tight, restricted muscles. So if there's trigger points, it's a great way to kind of get rid of it. A lot of runners use it before and after they run. So what we're trying to do is we're trying to basically squeeze the muscle between the foam roller and one of your bones and the weight of your leg pushing down or the weight of your body pushing down. The technique we're going to use is going to be 10 to 12 passes over each muscle, and while you're doing those passes over the muscle, you're going to do them slowly, and if you find an exquisitely tender part of the muscle, what you're going to do is you're going to sit on that spot for about 5 to 10 seconds and basically just sit on it until it squeezes out the pressure in that muscle, and it's a trigger point therapy or ischemic compression. Okay, for the posterior leg, we're going to start with the calves. Okay, so what you want to do is you want to position your foam roller on the floor. And what you're going to do is you're going to take your leg and you're going to put the middle of the leg right on the foam roller. And what I want you to start with is actually both legs on the foam roller. That takes a little bit of the pressure off and it's not as heavy. We'll move up from here. So what we're going to do is we're going to take our leg and you're going to work. There's 3 different parts of the calves that you have to do. One is the lateral or the outside of the calf. Then you have the middle of the calf, and then you have the medial part of the calf. So you want to work all 3 when you're foam rolling. Usually it's most tender on the lateral part. So we're going to start with that first. So what you do is you take your feet and you're going to roll them out to the side a little bit. So you're going to kind of roll your foot out to the side to get onto that lateral part. And you're going to lift your butt up off on your hands, and you're just going to roll back and forth. All the way up to the knee, all the way down to the Achilles, and back up and down. You're going to do that 10 to 12 times, and like I said before, if you come up and you find an exquisitely tender part on the muscle, you just sit on that and hold that spot for a second, okay? The increase for this is what you're going to do is you're going to put that one leg in the middle, you're going to put your other leg on top, and that increases the pressure on that. So you're going to do the same type of thing. Again, if this is better for you, if this feels better, you're going to do more weight with both legs, okay? Then you move to the middle. So you take your foot, instead of being out to the side like this, you're going to roll it up to the middle. Okay, so you roll up to the middle, you just kind of go back and forth again, 10 to 12 passes over that spot. Same type of thing. If you find a tender point, sit on it. Next, we're going to roll our foot to the inside to get the medial calf. So roll it this way again. Keep rolling 10 to 12 times over that spot. If you find a tender spot, sit on it for about 5 seconds and then roll through and continue the 10 to 12 passes. Next we're going to do is we're going to roll up to the hamstrings. So kind of scoot down there. There's 2 parts of the hamstrings you really got to worry about, the lateral and the medial. The hamstrings are hard to roll just because there's so much give to them. So what you're going to do is you're going to kind of roll over onto the side just a little bit. You're going to roll back and forth all the way up to the glutes, all the way down to the knee. 10 to 12 passes. Again, if you find that exquisitely tender point, just sit on it and then go through. Okay, then you're going to roll to the medial part. Up and down. All the way up to the glutes, all the way down to the knee. Again, if you find that tender point, just stop and sit on it for about 5 seconds. Next, you're going to roll up to the glutes. So basically you sit on it, and you can sit, just kind of roll over onto your side just a little bit, so you kind of roll over on your hip a little bit. You're going to roll back and forth on that. If you find a tender point, just sit on it for about 5 seconds. Another way to increase that is to get your leg up on your other leg. A lot more weight on there. You're able to get about 10 to 12 passes and really find a tender spot. Like right there, you'll sit on it. Then roll through. Okay? So those are 3 different techniques you can use for the posterior leg. Again, I'm Dr. Jason Schlenker of Schlenker Chiropractic. WestLinnChiro.com, 503-908-0582.